Forecast calls for another scorcher of a week with temperatures expected to be in the triple digits once again. The Houston Health Department has reported 6 deaths and more than 1,400 heat-related illnesses treated at local emergency rooms so far this summer. Joining us now to discuss how to keep heat-related illnesses at bay is Dr. David Persse, the Chief Medical Officer with the City of Houston. Dr. Persse, always good to see you. Let's jump right in this. This heat has been relentless for us this summer. So what are some of the top heat safety tips that our viewers need to keep in mind?
Well, first thing they need to do is they need to plan ahead. It's going to be hot, and you know what your activities are going to be for the day, so you need to plan ahead. We always tell people, you need to stay up on the hydration, right? You need to drink lots of liquids. But we warn folks to stay away from drinks that have got a lot of caffeine in them, a lot of alcohol or any alcohol in them, and large amounts of sugar. And the reason is that those will actually stimulate your kidneys, and you'll wind up drier than what you started with. The other thing is that you need to anticipate starting hydrating yourself the night before. If you know you're going to be outside all day tomorrow, working, exercising, whatever, drinking some water right before you go out, that's not enough time for it to actually get into your cells. So you need to pre-hydrate beginning the night before, quite honestly. And then the other thing is, some common sense. So don't do those most, intense outdoor activities during the hottest part of the day. So, if you're going to be exercising, you need to do it early in the morning, late at evening. If you're working, then I would really implore the supervisors and managers to make sure that your employees work early, work late, and get breaks, mainly breaks during the day. And those breaks have to get them into air conditioning. It's not just enough to sit out under the tree and drink a little bit of water. They really need to get into air conditioning in order to stay, healthy, so they can get the job done, right? And then for the workers, do what you can to protect yourself. So wear lightweight, loose-fitting, lightly colored clothes that will, easily allow evaporation and won't retain the heat. And also wear a wide-brimmed hat to keep the sun off your face and your neck so that you don't get extra sun and run the risk of, eventually developing a sun cancer. And then again, we always talk about not to leave children or pets or senior citizens unattended, especially like in a vehicle. And I think all of us have had the experience where you park at the grocery store, wherever, you shut off the engine, I need to grab this, grab that. And it's only a couple of moments before it gets really unbearably hot in the car. So imagine what it'd be like if you left a child or a pet in the car for, 30 minutes, 40 minutes, or longer. Those are all things that, again, a little bit of common sense. And then other things are during the day, if you're getting hot, make sure you can get into an air-conditioned facility. And pretty much every building in Houston has got air conditioning in it. If you don't have air conditioning, you can at home take some cool showers, multiple times during the day. Cold water showers will help a lot. And then last of all, pay attention to the heat advisories and what, like Channel 2 is doing right here by getting the word out and paying attention to what the weather is going to be like and those heat indexes in particular.
Yeah, and you mentioned the elderly. Why are the elderly particularly vulnerable to heat-related illnesses?
So the people without air conditioning live in homes. I didn't quite hear the question. Could you repeat it? Sorry.
Yeah, you mentioned the elderly. Why are the elderly particularly vulnerable to heat-related illnesses?
Yeah, so the elderly, our bodies have the ability to adjust to the heat. So our bodies have cooling mechanisms, right? And we also have to stay hydrated. And so when we're little, and when I say little, I'm talking about, kids over the age of 5 or so, their bodies are really good at that, right? But as we get older, just like everything else, our bodies become less well adapted to managing the heat. And so, the folks who are elderly, when we talked about you have to actually hydrate the cells, so it takes longer for elderly folks to be able to get the hydration into their cells. And also a lot of elderly folks are on medications like diuretics that will make it more difficult to hydrate themselves. They've got other medical problems that impact their body's ability to manage heat. And so the elderly are at really increased risk. And so this is why we want you to watch out for your elder relatives, the elder neighbors in the street, friends and family networks are really important for protecting the elderly from the heat.
Yep, you can't stress it enough. Dr. David Persse, appreciate your insight and your time this morning. Thank you so much.
Absolutely.